Hello, my name is Alejandro Gonzalez. I'm a public health researcher at the University of Bradford. I'm recording this video in advance of our meeting next week. And what I'll do in this video is explain to you a bit about the project that we'll be discussing, and also to let you know what to expect in the meeting that we'll have next week. I prepared a very simple set of slides that hopefully they're going to give you a better understanding of what we'll talk about the project and what we'll do. But if at any point you have any question or if you think that there's something that's not clear enough, just let me know and I'll be more than happy to dedicate time to answer your questions. The research that we'll be discussing next week will try to answer the question, how do stroke survivors' age, gender, ethnicity, and level of deprivation influence the prescription of medication to prevent a second stroke? And to do this, I will analyze what stroke survivors' characteristics, such as age, sex, ethnicity, and level of deprivation, reduce the chance of receiving medication to prevent a second stroke. We know from previous research that some people are more affected than others. And although there's a lot of medication that we could talk about, I will focus only on two, which are blood thinners or anticoagulants and lowering cholesterol medication or statins. And why is this important? Well, these two medications, blood thinners and anticoagulants, and lowering cholesterol medication, reduce the chance of having another stroke. So that means if you take this medication and you had a stroke already, your chances of having a second stroke will be lower. But we also know from research that 1 in every 3 stroke survivors do not get these medications. And why does this happen? Well, we know also from research that the prescription of these medications is influenced by characteristics such as someone's ethnicity, age, and also the level of deprivation of that person. And just to give you an idea of how this research works, well, if we want to look at a high-income 55-year-old white man, well, probably that person will have a higher chance of receiving the medications compared to someone who is 75 years old, who is a woman from a South Asian ethnicity. And how will I do this? Well, to answer this question, I will use data from two sources. One is called Connected Bradford, and that has information from the residents of Bradford. And I will also use data from the British Heart Foundation, which has information from all the UK. And the method that I will use, it's called intersectionality. This method will allow me to combine the characteristics that I mentioned, such as age, sex, and ethnicity, and see how the combination of these characteristics influence the chances of being prescribed any of these two medications. This method is relatively new, but it has been used in other research to explore the prescription of other medications. But it has not been used yet to explore stroke research. What are the impacts and benefits of doing this type of research? Well, we can think of 3 areas where we could have impact. First, we could think of the stroke survivors and the carers. So they will benefit from this research by producing evidence about the difference in these prescription practices to improve future care. So based on the information that I gather from this research, I will be able to identify who is not receiving the medication they need and inform practices so those people receive that medication. The NHS will also benefit because we will be able to identify individuals who are less likely to receive the medication and implement strategies to improve those practices. But it will also benefit policymakers because they could use this information to address this gap. So once we know there's a particular group who's not receiving the medication and we understand why that's happening, then we could inform policies or initiatives at the policy level to inform and to improve the practices. And this project has involved experts by experience since the very beginning. So I've created an experts by experience group consisting of 4 stroke survivors and 1 carer, and they informed the methodology, they helped to shape the research question, and they basically have allowed us to be at the stage that we are now. This group is diverse in terms of these characteristics that I'm exploring, such as age, ethnicity, socioeconomic status, and years of experience with stroke. And as I said, this group has informed the research question and will continue to play an essential role as we're doing it right now and in the following weeks as well. And just to give you an idea of how the group has shaped the research, conversations with the group highlighted that some of them experienced more difficulties in accessing prevention medication during COVID. So this led to asking the question, well, did everyone face the same challenges? So what are we doing next week? As part of the project, I will involve experts by experience to contribute at different stages. So they've contributed to develop the research question, to inform the methods, and now we're working on something even more specific. And why are we doing this? Well, we know from previous research that having a clear set of expectations and responsibilities makes it easier to working together. And this applies at any stage and with any people, but also applies with experts by experience and researchers. So on the 10th of February, we will talk about the roles, expectations, benefits, and responsibilities from everyone involved in the project. We're working with something that has already been generated at the university. So we have a template that I will share with you. But this template has different sections. So we'll talk about, for example, the expert by experience role responsibilities. There are some key things that are pretty much set in stone, such as to be a representative of the views and concerns of other patients and carers, to identify ways in which the study could be improved, but there's also space for us to add any responsibilities that we think are important and necessary to include. We'll talk also about the commitment. So how often do you think we should meet as a group? What do you expect in terms of the length of these meetings or this commitment? And the term of involvement. How long do you expect it to be? 1 morning a month for the duration of the grant, once every 2 months, once every 6 months. So we'll talk about that. And also we'll talk about the requirements for good partnership, working and access requirements. And this is really important because we want to make sure that everyone, especially in the context of stroke, where people have different difficulties, different challenges after stroke, that everyone can contribute and their voice can be heard. So we'll talk about communication prior to activities, at least what number of days. How do you want me to communicate with you, which could be by post, email, how many times, how many days in advance before feedback required for the meeting. So I hope that this gives you an idea of what to expect. I will share some more information during the day next week, But again, if there's anything you want me to address or anything that is not clear so far, just let me know either by email or during the meeting next week. I look forward to meeting you all. Thank you very much. Have a nice day.